Hello, I'm Dr. Stephen Steep from the Oxford Veterinary Hospital. I want to welcome you to my clinic and invite you to join us as we explore a very exciting and interesting topic. Today we're going to look into something of concern to anyone who has a pet: emergencies. Sometimes it's obvious. You hear the squeal of the brakes, you hear that blood-curdling yip, and you see your little pup running back to the porch holding a leg up. Other times, though, it's not quite so obvious. You get up in the morning, there's vomit on the floor, you look over at your cat. Is it a hairball, or is it something more serious than that? You've got to get the kids off to school, you've got to go to work. What do? Well, stay with us. We're going to show you how to figure it out. Along the way, you'll also learn some new skills. Watch for the next 30 minutes while we talk all about animals. Emergency. It even sounds scary. It's one of those things that, you just know it when you see it, right? Well, serious but unforeseen situations that demand our attention can arise with anyone at any time. Vomiting can be from a small hairball, or it could be a twisted bowel. We don't know the difference until we assess and evaluate our patient. The bottom line, though, is if you think it's an emergency, call. Call your veterinarian, call your emergency clinic, get some help. You're never wrong to do that. There's a few things, though, that obviously demand our attention, and there's a list that we get from our friends at the American Animal Hospital Association. Let's go through that list just so it's clear. If your pet's been experiencing some kind of injury or trauma, and maybe it was hit by a car, a blunt object, or it fell more than just a foot or two, it should be seen. Internal injuries can occur and you have no way to know. If your pet isn't breathing, or you can't feel a heartbeat, it needs to be seen. If your pet's unconscious or won't wake up, it stands to reason. Your pet needs to be seen. If your pet has been vomiting or diarrhea, we get calls about this all the time, but if it's been more than 24 hours or if you see any blood, your pet should be seen. If you suspect broken bones for any of a number of reasons, your pet should be seen. If your pet is having trouble breathing or something caught in its throat, it's not time to wait. It should be seen. And we'll try to show you, if there is something caught in its throat, what you can do at home. If your pet has had or is having a seizure, one of the most scary events that a pet owner can have. I experienced this personally. 4 in the morning, my little Molly had a seizure, and I was beside myself. And I'm a veterinarian. It's just very, very upsetting. But your pet, you need help then, and your pet does need to be seen. If you notice any bleeding from the eyes, the nose, or the mouth, if there's any blood in the urine or the feces, have your pet seen. If you think your pet may have ingested something toxic, such as antifreeze, rat poison, any of a number of things, your pet should be seen. If your pet has consumed any medication that was not prescribed for it, maybe it belonged to you, pill dropped on the floor, we get calls like that all the time. You need to at least make a phone call. Find out, is that toxic to your pet? If your pet, male cats are especially predisposed to this. If your pet, though, is having any difficulty urinating, straining to urinate, don't wait. Have it seen immediately. Very important if your pet is in labor and has gone more than 4 hours without delivery. You need some help. Make that phone call. If your pet seems painful, and you can determine if your pet's painful by vocalization, whining, shaking, trembling, refusing to socialize or interact with you, then your pet should be seen. If your pet collapses suddenly, can't get up, should be seen. If your pet's bumping into things, suddenly becomes disoriented, time to be seen. If there's any irritation in the eyes, we don't wait with eyes. It's one thing to have a sore on the leg or on the skin, but if there's anything to do with the eyes, we don't want them to lose vision. Get them in right away. If the tummy's swollen, if it's hard to the touch or seems painful, it's time to be seen. Heat stroke. Pets are very susceptible to heat stroke. They run a higher temperature than we do. We're going to teach you how to take that temperature, what's normal, but if we have a pet that's overheating, it needs to be seen. So anytime you are experiencing something you're not sure of, anything from this list, then it's time to call your veterinarian, call your emergency clinic, and get some help. Let me take you to another part of the hospital, a part you seldom see, and I want to introduce you to a little friend of mine, a very dear friend. and we're going to show you some of the techniques that are important in assessing your pet in an emergency situation. Well, here we are. This is our surgery room. We're going to use it for another purpose today. And I want to introduce you to my friend. This is my little Molly. Molly's a rescue. She was found by Detroit Animal Control down by the Ambassador Bridge. She was just a baby. She came to the Healthy Pet Surgical Suite at the Michigan State Fair to be spayed. And while she was there, I was the doctor in charge. I took one look at this little girl. I could not send her back to the streets of Detroit. She came home with me that night, and she's been there ever since. She's pretty much spoiled. She sleeps where she wants, usually the foot of the bed. She eats pretty well too. So when we use Molly as an example of emergency care, she's a good one to work with because she's very skittish. If I touch her suddenly in a spot, she'll yip and let out a blood-curdling howl, and heaven help it, if anybody she doesn't know goes for, she'll nip. And so we want to talk about that. And so that list of emergency conditions that we talked about, well, those are the obvious ones, but what if it's not obvious? You know, I know Molly, and you know your pet. I know when she's hungry. I know when she wants to play. And I'm pretty good at determining when she doesn't feel good. And I think you are too. So with that on her mind, I know that she has a pretty good idea of what I'm thinking. She sure in the heck knows what I'm saying, and she almost always knows what's coming next. She's got life pretty much figured out, but she's got all day to analyze things, right? She just can't talk. And so when she doesn't feel well, is it a bladder infection? Is it a tummy ache? Has she got diarrhea? I've got to watch her. I've got to figure it out. It's times I just want to ask her, what happened? What'd you get into, kid? You know, where did this all start? But she's not talking the way that we expect her to. She does talk, though, in her own way, and her body talks. And so we can analyze that. We can learn that language, and we can assess her, and we can put all those pieces together. But the first step is extremely important. If I came into the room and Molly's sitting there on the floor, if she's anything other than unconscious, bleeding, or gasping for air, I'm going to assess her from a distance. I'm going to take a look at her. So here she is sitting here, and if you reach down and suddenly grab her, that's what she's going to do. She doesn't like that. And she knows me. Imagine if a stranger did that, what she's going to do. So we have to first assess, is she bright, alert, and responsive? Does she show any signs of pain? Is she breathing normally? I can hear her breathe. I can watch her chest move. I can see her little mouth open and her panting. Is there any injury or obvious wounds that she has? And I don't see anything. Everything looks pretty good. But if I need to assess her, I need to know that. Once I determine that, I can decide if it's safe to reach down and then to gently pick her up and put her on the table or do what I need to do to assess her. But if she's shaking, trembling, showing signs of pain, I better do something else because she's going to react, and she's going to react in an unpleasant way. She may even bite me if she's in pain. And if she does, she may jerk and run away, and that could make whatever injury or problem is present that much worse. So there's a few things that we can do to safely handle our pets when they're painful and when they may injure themselves or us. Number one, get help. So I'm going to call for some help. Kelly Coulter, would you want to come over here and give me a hand with our little Molly? So little Molly is a good friend of Kelly's. We'll let him visit for a second. You'll notice that we have a leash. Can't stress the importance of a leash. When a dog isn't feeling well and they don't even want you to touch them, you simply take a leash like this, make a noose, put it over their head, and now I have control. I can move her in different directions, and I can do that safely. Sometimes, though, dogs will actually jump up and try to bite if you try to put a leash on them. They're not used to it. In that situation, we use another tool. Kelly, would you hold that leash? Sure. I'm going to reach over here. For dogs that have a leash but won't let me get close or won't let you get close, take a big, heavy bath towel, slide it down over the head, and then reach around like this. And now we've got an immobilization around the neck, and it allows us to grasp the neck. It's okay, dear. It's okay. Gently. That's what I mean. That's what happens. She knows this is not natural, and she's afraid. Look at the body language. Her ears are back. She's trembling. Nothing's happened to her. But if she was injured and did that, this could be a time when you would get bit, and it would make things that much worse. That towel could be very important to immobilize her. We could also use a large quilt or a blanket. Good girl. Good girl.
Good girl, Molly.
You want to give her a treat?
Sure.
we could use a large quilt and we could wrap her up in a quilt. But we also never underestimate the value of the muzzle. Many people don't have these at home, but they're very handy. And it's not to be cruel, but it is to immobilize the mouth. These muzzles are available at pet stores. They come in various sizes. And what we do with a muzzle is just gently slip it over the nose, like that, and then up behind the ears. Now this is pretty unnatural for Molly, and she's not real happy about this, but that does have almost a very calming effect because she can't do much with that at this point. She's in a submissive position, and so if she suddenly moves and jerks, she's not going to hurt me or anyone nearby. We'll take it off. All done, sweetheart. If you don't have a muzzle and it's an emergency and you want to immobilize her, sometimes you can use a little plastic cup. Here's one we fashioned. Works very well for small cats and dogs. And then as we're holding her, we can slip that right over her nose, like that, and then hold the base of the head and the front of it, and that will keep her from biting while we try then to assess her. If she has a bleeding toenail or some other problem, that can keep that nose busy while we're working on what needs to be done. I could never do this alone. I need help, and so do you. Other things that we can use, come on, Mom, good girl. Other things that we can use include pillows. If she were moving around and having a seizure, we could use a pillow to immobilize her. And once we've got her stabilized to the point where we can, get your nose over here, you can't eat any more of those treats. Once we've got her immobilized the way we want her, then we can start to assess her. And what we're going to look for is the ABCs. Does she have a patent airway? Is there air going in and out? Is she breathing normally? Does she have good cardiac function? We're going to show you how to take her heart rate. And what's her pulse like? If she doesn't have any of those, then we're going to be ready to perform CPR. And we're going to get to that just in a few minutes, but first we need to cover the vital signs. So we're going to move into another room with Molly, and we're going to show you how to do some pretty interesting things to assess the inside and see how she's functioning. So now let's take a little closer look at the insides of Molly. These are what we call the vital signs. When you come into your office with your pet, our technicians will greet you and talk to you about your pet, what your visit is for, but they're also checking your pet, looking for specific things that they're going to share with me before I even come in the exam room. And if your pet is sick, not doing well, or you're just not sure, then you want to assess vital signs at home. One of the first things that we do is the assessment we told you. We stand back and we look, we make sure it's safe. We're past that point. We've got Molly up here on the table. And so now we want to look at some key areas. Number one, what's her circulation? Is that blood pumping? Is the heart doing what it's supposed to do? Well, a good way to tell is to look at her gum color. And we hold that gum up and it's nice and pink. And we blanch it out. We press down and pinch that off. It's white as a ghost, and then the pink comes back. If you time that, 1001, 1002, in less than 2 seconds, her perfusion comes back. If your pet shows you another color, if it's blue, if it's white, if it's gray, something's not right. And that might be your only clue. So check that gum color and the perfusion. Make sure it comes right back. Can you hear her breathe? You can see her tongue out. We can count those respirations. Is she breathing too rapidly? Is she breathing too slowly? Is she making too much noise? These are observations you can and should make at home. We want to know what her heart rate is, but do you know where the heart is? You need to determine that. Molly, turn this way, dear. So from the side, we'll stand her up. I've got this furry little dog's front leg, and I'm going to lift it up, and this is the point of her elbow. And if I lift that leg up and then press right here where that point of the elbow is and let it go back down, with my fingertips, I can feel that heartbeat. And then I can count. Typically, we count the number of beats that take place within 15 seconds and multiply by 4. And that gives us the heart rate. We check that. It's pretty easy to do. You can learn to do this. But don't wait for an emergency. These are things you should be doing right now with your pet. So when this show's over, jot it down. Come and check the gum color, check the heart rate. In addition, let's move on to the back side. We're going to turn her around. Just because the heart's beating doesn't mean that blood's pumping, right? We all know what can happen with bad hearts. So on the inside of the hind leg, reaching underneath gently with your fingertips And rubbing along the inside surface of that hind leg, we can actually feel the femoral pulse. Do that with your dog or cat. Just gently press down into that furrow and you'll feel a pulsating vessel. And when your fingertips are on top of it, keep it there. Get comfortable. Start to count. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12. I did it for 6 seconds, so multiplying by 10, that's 120. That's a normal heart rate. Normal pulse rate correlating with a normal heart rate. So if we check her gum color, we check her for breathing, we check her heart, and we check her pulse, we put that all together, we have some information that we would not otherwise have. Now, the fun part, temperature. Dogs do not put their thermometer under the tongue. Ears are not a good place to take it. You got to do it like you do for babies. So we're going to take her temperature rectally. We like to use veterinary thermometer, but you don't need a veterinary thermometer. You can use one from the drugstore, one of these little battery-powered thermometers. The days of mercury are long past. And it's simple enough. We just zero it out, start it up. We lubricate it. You can use a little Vaseline. You should have that at home with a well-lubricated thermometer. Someone should hold her and be prepared. Molly does not like this. We're going to gently lift her tail. Good girl. We brush the hair away and we can see the anal opening. It's right here. We don't have to go far. We just gently insert it and we wait. These will beep. So we have to talk to her and comfort her, but this is how you take the temperature. Now, I'm showing you all this, and here we have a temperature. It's beeping at 101.6. Now, if this were my child, I'd be worried, but this is my dog, and I know what normal is. You don't. You don't know what normal is for the heart rate, the pulse rate, the breathing, or the rectal temperature. But we're going to help you with that. We've got a chart with all those vital signs. What's normal for cats, what's normal for dogs. And we're going to make that chart available for you on our Facebook page. So more about that later in the show. But get used to doing this. Do this with your pet at home. Learn how to do it when they're healthy, and you'll find out what is out of whack when they're sick. Some pets run a normal temperature of 103. And if you didn't know that, and you took the temperature and found it to be that high, you would worry needlessly. Some pets run a lower temperature. So the key is to learn what's normal for your pets. Just like you know when they're not right from the outside, learn what's normal for them on the inside. Okay, so now we've got her vital signs, but she's still not right. We don't know what's wrong. We need to learn more. So, but armed with that, we've got a good head start. So then, how do we figure things out? What's normal, what's not normal, what do we do? Well, let's start up here, nose to tail. That's how we do our examinations. Let's look at her eyes. We can gently lift up the lids. And as we do, we look at the whites of the eyes. Are both eyes visible? Are they clear? Are they glossy? Can you see the whites of her eyes? Is there any swelling, anything abnormal? I showed you how to check her gum color, but what if there's something in her mouth? I want to open her mouth, and she knows that I can do this. So I can open her mouth, I can reach down, I can pull anything out that doesn't belong in there. If she had something caught in her throat and was gasping, I may need to open that mouth. I may need to do a sweeping action and clear it out. Can you do that with your pet? Are you comfortable working in your pet's mouth? That's something you need to determine before an emergency takes place so you know what to do. Ears, very sensitive area. Dogs don't like their ears played with generally. But if there's a problem there, if there is a problem there, you need to figure it out. So you may need that muzzle, you may need to hold her, but you should examine the ear, you should look into it, you should gently touch it for sensitivity, and then one other sense that's very helpful is the sense of smell. Put your nose right down there, smell. Is there any unusual odor? Is there anything there that clues you into a problem, and is it painful? That's very important. Use your hands, come back, gently touch and feel her neck and her throat. I'm feeling for swelling, I'm feeling for any sensitivity, and I'm going to move all the way across her body, pressing gently. If her tummy's painful, I'm going to be able to tell that, and then I'm going to work on her legs and her limbs. Kelly, you want to hold on to Molly for me? Let me step over here. Toes and feet are another area. If there's a lameness, we should just gently touch and move down the leg and see what we can do. Touching the feet, looking carefully at the toes. Now watch how Molly reacts. She doesn't like this, but we're going to be very gentle with her. We're going to examine each and every little toenail. We're going to put our fingers in between the pads of the feet. We're going to check for anything that's out of miss there. A cracked or broken toenail is very painful. And if someone's holding her, I can examine each and every one of those until we're done. And you probably determined this when you looked under her tail, but if there's any stool, anything trapped back there, fecal mat, evidence of diarrhea, we're going to be able to find it. So nose to tail, that's what we need to do with our physical examination. So little Molly needed a rest. That was hard on her. And I brought in our resuscidog, Alfred. So Alfred's here to help us teach you how to handle cardiopulmonary resuscitation in dogs and cats. Along with Alfred, we have one of our fine licensed veterinary technicians, Rachel. Rachel, come on over here and join me. So when it comes to CPR, we have to know that it's indicated. You certainly don't want to try to breathe for a pet, or you don't want to do chest compressions if there's no indication for it. It could be harmful to your pet, it could be harmful to you. But Alfred's comatose. Alfred's not responding. We've taught you how to assess him. We've lifted up his gums. His gums are pale. We didn't see any evidence of breathing. We checked for a heartbeat. We didn't find a heartbeat. So now we have to act rapidly to reinstitute breathing and a heart rate. And we don't have time to drive to the emergency clinic. It's now or never. So we're going to do this. First of all, secure the airway. Open up that mouth, pull the tongue out, make sure that there's nothing caught in there. Remember what I taught you about that sweeping action in the back of the throat? If there's some tension in the jaw and you're afraid you're going to get bitten, an assistant can help you, and Rachel could help hold that mouth open. If there's some convulsive activity or other reasons that you don't want your hand in the mouth, you can take strips of nylon or strips of fabric. You can even take the leashes and put that into the mouth and hold it open while you examine and you make sure you've got a clear airway. Once we have that, we've established that Alfred's in need of care, then we're going to start resuscitative efforts. We need to breathe for him. So Rachel, do you want to go ahead and demonstrate how you cup your hands over the mouth and nose and go down and institute rescue breaths? So Rachel's going to do rescue breaths and immediately start to breathe for him. The number of times isn't as important as the efficacy or how effective you are at making it happen. You want to see that chest rise, and so you're going to have to cup it. Now, Alfred's not going to show us that type of response in this, but your pet would. And if it's a small animal, you may actually just put your lips right over and seal that off and gently blow. If you've cleared everything out of the way, the germs will be gone. You can brush your teeth later. This is your pet's life we're talking about. Go ahead and you institute rescue breaths. Remember where the heart rate is, where it should be. We're going to bend that elbow, and where the point of the elbow is on the chest, that's where the heart is. We're going to start chest compressions. And you can use your hands like this. You can do what you've taught if you've taken human CPR. You can make a fist. The idea is pressure on the chest in the area of the heart. And we're going to press down. How far, how much pressure? Boy, that's a tough one. But generally, you want to push down until you've compressed that chest by at least 1/3. Okay? And we're going to press down and compress by 1/3. You know the old technique where you press 5 times and breathe? That's fine, but you don't need to do that. You need chest compressions, and they have to be rapid. So we're going to do 80 to 100, 80 to 120. We're going to just keep compressing while she breathes. The way that this works is that we're not compressing the heart by our pressure directly over it. My hands are not wrapped around that heart. We have a thoracic pump, filling those lungs with air, compressing against it to the point where pressure increases, forces some blood through that heart, through the lungs to pick up oxygen. Blood's going to be shunted to the heart, to the brain. Those are the 2 key areas. And we're going to do that just as you would in a person for 60 seconds, a minute to 3 minutes, and we're going to do that. And then we're going to stop and we're going to assess and see where we're at. We're going to check to see, did we start a heart rate? Did we start the heart rate? Is it going? Is the color coming back? Are we effective in this? And we're going to check for a pulse. Remember the femoral pulse. The nice thing about Alfred is we've got this little pump and we can teach you where to press. So when we do our demonstrations in the community, pet first aid demonstrations, we'll bring them along and you can do a hands-on. It's excellent to put your hands on the chest, press down, and see how it is. Small dogs and cats, you can put your hands on each side and gently compress. Folding your hands together, pressing on the chest, compressions, that's how we're going to get that heartbeat going again. This is very important. So you can't really practice on your pet, but if you're a client of the Oxford Veterinary Hospital, you're welcome to come in anytime and we'll set this up. If you're in the community, we'll be happy to come out to community centers and do a demonstration on this, along with an expanded discussion on pet emergencies. Well, let's take a minute and show you a couple of things that could come in handy. Those nasty wounds where there's blood all over the carpet and sometimes the tail's bleeding and there's blood on the wall. You can even get blood on the ceiling. That trip in the car to the emergency clinic or your veterinary hospital could be a nasty one. So there's some things you can do at home before you take off. For us to accomplish this, we brought in a new friend. Rachel, who did you bring in with you today?
This is Manny. He's about 2 years old, yellow lab. We got him from rescue, from the Clarkson Companion Animal Rescue, about 2 years ago, at the age of 6 weeks old, and he's grown quite large, and he's like any lab. He loves his treats, and he's very food motivated, so that helps with a lot of the training with him. So
he's a very handsome dog. He's very well cared for, but I understand he's also a celebrity in Oxford, isn't he not?
Oh yes, he just won the Scarecrow Festival Most Original and Best Overall Costume. He was the Headless Horseman, but he was the horse with the Headless Horseman on back.
Well, Manny's a perfect patient for us today because we want to talk about bandaging feet, and that can be so challenging. Some dogs don't like it. You remember how Molly was when we touched her. Manny, on the other hand, he's pretty good-natured, but we do have some supplies and we have everything out. It's very important with your pets to have everything you need handy because they won't sit there with their paw up in the air while you run to get the bandage scissors. So make sure you've got everything set. Remember, you always need a helper. Don't try to do this by yourself. If you're by yourself, you may get by with it, but it's better to call a friend or a family member and see if they can help. Treats can distract him. You'll see that Rachel's doing that. We're going to get down and focus on the feet, and we're going to use a few things. The first is, what layer are we going to put against the wound? And we happen to have some Telfa pads. You may not have Telfa pads at home, but I bet you have some large Band-Aids. You may have some gauze pads. There's many things that you can use right on top of the wound. We want to make sure the wound's clean, so we may need to clean it. We may need to use a little peroxide or some gentle cleaning, rinse and pat dry, and then we're going to use an antibiotic ointment. It doesn't have to be veterinary specific. You can use Neosporin, you can use Bazatracin, many good choices. So we're going to clean and dress the wound. We're going to put a primary covering on the wound, and then we're going to wrap the wound. And what we brought in today is some stretch gauze and an outer layer. What we don't have and what we're missing here is a padded layer. And so if you have some cotton, that's always very helpful to use a padded surface on it, but most people don't have that at home. And so you may be limited to what you see here. The important thing to remember with a bandage is that it should be temporary. A bandage can be very beneficial and helpful, especially with a bleeding wound when the right amount of pressure is put on it. But a bandage can also be devastating if it's too tight, or if once the bandage is in place, the animal shifts and moves his body weight, changing that from a protective bandage to a tourniquet. So let's take a look at Manny's foot and see what we would need to do to bandage it. Rachel, if you'll hold Manny's paw, then we would clean the wound. We'd place some antibiotic ointment onto the wound. Then we want a no-stick surface. It's all right, sweetheart.
Good boy. Good boy.
And we want to start to wrap it because it's not going to stay. So I'll set everything within reach. So I'll try to hold that in place. While I do that, I'm going to try to wrap this. Not too snug, not too tight, but certainly not so loose that it's going to fall off.
Good boy.
Good puppy. Yes, you are.
Good boy, man.
Did Mommy give you all your treats? We're going to go a little higher than the wound because we're going to allow it to secure it. You may even want to go above this accessory carpal pad, but if you do, go gently. Not too tight, because remember what we said about a tourniquet. The more we put on, the more padding that we're going to have. Overlap. So there you have it. Now that bandage would be sufficient to secure that wound, minimize bleeding, and that would suffice to get him to the emergency clinic. So Manny, thanks so much. You've been a great patient. You look beautiful with that pad, that foot bandaged up. And if you chew that off, mister, no more treats for you.